Hi everyone, I am Natalie McGee. I'm a social media manager with Tank Worldwide, and I am joined by Jen McCann in partnership with the NYFA to talk about women in STEM and the role that women in STEM can play in advertising.
Hi everyone, my name's Jen McCann and I am the Senior Vice President of Medical Strategy at Tank Worldwide, and really excited to talk about all the things that have led me to my role that I have at Tank Worldwide today.
So I think, Jen, we can start with how you have landed in your role as SVP of Medical Strategy at Tank.
Yeah, it's a great question. Really one of the things about me is I love science, I love figuring out how things work, and I also love communicating that to bigger groups, depending on whether they're kids in elementary school or doctors or students at university. I just love to be able to talk to everybody. So pairing that with the scientific knowledge that I gained in all my years of research when I was going through my undergrad and my master's and my PhD and my postdoc, it's really allowed me to have a really good foundation to whatever I say. I can back it up with evidence and data and make sure that, in my role as a medical strategist at Tank, everything I say is based in a different, it has a foundation that resonates. Now, when we go back to where I started and how I ended up here, I started out in research, transitioned into medical writing, didn't know what that was, had no idea. Someone said, hey, I heard someone needs a medical writer. And I was like, I'll try it. So I went, started it. And that's when I had my first foot into the agency world, which I also didn't realize that there were agencies that were pharmaceutical represented pharmaceutical companies. And when I discovered that, it would allowed me to pair my love of science with my love of communicating and really get that idea of how do we reach people. So when you take that medical writing job, what it really is, it's about taking these complex scientific topics and changing them into a way that doctors can understand them, or nurses or pharmacists or patients or caregivers and all those people who we're trying to address. So taking that information and communicating it is one thing, but determining how you're going to get the best information that's going to cause behavior shifts. So let's say you have a doctor who, I'm not going to use that drug because of A, B, and C. We got to get down into the nitty-gritty and figure out why he's not using it, and that's where the strategy comes in. And once we figure out the why, then we figure out how we can shift their behavior so that they're more open to trying different things. So that's where medical strategy really can play a big role. And at Tank, what we've been able to do is I identified the gap with the strategy team, and I said, I think medical strategy would be a really good thing to add to the Tank armamentarium of offerings for our clients. And by approaching the strategy team and working closely with them, I started off as the only medical strategist, and then I started to build my team, and now we're 5 strong. 4 of them are women, which is, for me, it's always great to see, because if we're able to have women in science going on to these careers where they can see other opportunities for them, it's a very strong support for how I've approached my career and how I can help other people fulfill what they want to do. So for me, the medical strategy department at Tank, although relatively new, I think it's only a couple of years old now, I think we're growing and growing, and I'm really excited on what comes next for Tank.
Yeah, that's so exciting. I would love to talk a little bit more about your thoughts in the value that a medical strategy department adds. I mean, like you mentioned, I feel like so few people that aren't maybe directly at agencies that work with pharma clients even know that pharma advertising is a thing. Yeah. What is that value that you think that brings to our pharma clients or in the pharma space?
So I think strategy itself is very, very important. There always needs to be everything we propose to our clients needs to be rooted in a really strong foundation of strategy. Mm-hmm. What medical strategy allows us to do is add an extra layer, because oftentimes we're speaking to healthcare professionals or patients or caregivers and people with different conditions or diseases. Everything we say needs to be backed by evidence. We need to have very strong foundation in the data to support what we say, because when we put it out there, it needs to resonate with the end user. So if you put something out there that is not backed by data, a doctor's going to say, I don't believe you. If you approach something, or if you have a strategy in a way that does not reflect the realities of a doctor, then he or she will be like, I'm sorry, this doesn't speak to me. Mm-hmm. So it's really, strategy is strategy, but medical strategy adds that layer of data for the medical profession. And it also adds a layer of authenticity to whatever we put out there, so that what we say, will make that behavior change, let's say with a doctor, or let them look at the drug in a different way. And in the end, our clients will be much happier because they have happy end users, and they get them in a way that is something that is relevant to them.
I love that you mentioned authenticity, because I feel like that's just, more and more we're seeing more brands, like that's the goal, is to be authentic. How can we authentically communicate,
Right.
To people, to brands? And so I love that you mentioned that as like a main part of why medical strategy is so valuable.
Right. And I think, just to jump off that, is like one of the things we try to do at Tank Worldwide is this like purpose-driven creative. So Tank is a creative agency first, and we as a strategy team, whether medical or brand strategy or a customer experience, we all try to work together to make sure that the creative is as strong as it can be. But it's not just creative for creative's sake. We try to do it in this purpose-driven way. Our end goal is to always have something that is going to resonate with everybody that we're trying to reach. And so whether it's, getting more prescriptions filled, there still has to be something there that makes the doctor or makes people go, oh, this is work that really makes me want to listen to what your message is, and then maybe that'll be, either result in more prescriptions or result in more opportunities with KOLs or that kind of thing, or KOLs, key opinion leaders. So it's one of those things where I think the strategy really helps build that foundation and give, to your point, the authenticity that we need in order to get the end product that we're looking for.
And right now, where does medical strat come into the creative process overall? How do you feel like this most adds value to the creative process at an agency?
It's a great question. So I think at Tank Worldwide, we do things a little bit differently than I've seen in other agencies. We have, because we have these medical strategists, they know the data, but they also know what the creatives need to hear in order to build that creative story that's going to be impactful. And so we can be involved anywhere along the process. So if we're doing a new creative campaign or a concept, oftentimes we will be in the beginnings of writing that creative brief, figuring out what the tensions are, looking at to see, well, how are people behaving and how can we look at that behavior and change it or use it to leverage, a shift in how they're doing things. And it's just as a brand strategist would, a medical strategist does the same thing, but what they do is they bring a layer of data and healthcare specific information that will help build authentic creative. So it's like we can start at the beginning. Sometimes, one of my roles sometimes is to see what the creatives have done and go, that you cannot do, or are you doing this? Like we have to look at a regulatory lens sometimes, which a lot of the creators hate when I show up, but it is true, right? There's certain things we're not allowed to do in the healthcare, and we need to be aware of that. And as a medical strategist, that's one of the things we do. But it's also, you can't put stuff out there where a doctor or a patient's going to go, are you crazy? So we need to be very careful in how we do things. So the creative, we never want to stifle creativity, but we want it to be responsible. And because if it's not responsible, then people are not going to listen. So that's really where we play a big role in that, to make sure that everything is like follows the rules, basically, which there are a lot of in healthcare. And we also, sometimes get pulled into things that aren't even really part of our role, but really want to help, and we're problem solvers at heart. That's what we like to do. And so sometimes a problem will pop up and they'll say, Jen, can you think of a way of doing this? I'm like, I'll get back to you. And so it's a real, it's a great opportunity. And it's one of my favorite things to do at Tank is to collaborate with the creative team, because you can think all you want about stuff and you can come up with these great ideas, but until you see it turned into something that is like, wow, that's emotional, it's a real, it's kind of like going from A to Z and seeing all your good thinking and how you've worked together. And the best thing about it is we all collaborate, and that's what I love the most, being able to talk to people and work with people and try to help, if there's issues that they need to work out as far as like projects and stuff. That's kind of where we're everywhere.
Yeah. And I'm sure it just continues to change too. I mean, you're a pioneer. Medical strategy is just continuing to kind of grow and change. Where do you maybe see it growing? Do you see it changing? Do you see it just becoming more like of an industry standard?
Well, I think it is. There are other groups that do medical strategy, but I think that from what I've seen, they do stuff that's much more in the clinical trial basis, getting the data. And what we've done in MedStrat is really take that knowledge and also go to the next, we talked about creative, we work with the creatives, and that's something that's really important. What I see next is like now that our team is growing, which helps a lot, is that we can have medical strategists embedded with all the brands at Tank. And so they become brand ambassadors. They are the keepers of a lot of the knowledge. In addition to the medical writers, they work very closely with them. And I see that I want it to come to a point where an account person will say, I need to reach out to Jen to find out if we can do this before they go and do it.
Right.
And if we get to that point, then I think we've succeeded as a team. We're getting there. I think that's working for some groups is really they bought into it, and others they need to learn how to work with us and stuff. And of course everybody has a different way of working. So that's another thing we have to adapt to the way they work. So if we become indispensable, then that would be amazing.
Yeah.
And I think as we move forward and we have more different opportunities, we'll see what else we can do. I think it's the sky's the limit right now for sure.
Amazing. And maybe just jumping back a bit to kind of your team. You have a team of 5, 4 women. Woo, love women in STEM. When you're looking to bring in a new medical strategist, what are kind of like, what's a medical strategist toolkit?
So it's a great question. I don't have a criteria. First of all, when I interview people, I like to obviously see their CV. They need to have an advanced degree in science. I like somebody to have that solid, not just an undergraduate degree, but like a master's or a PhD, because then I know that they're good at problem solving, troubleshooting, which when you do research, that's pretty much all your day is. You're trying to figure out why didn't this work, why didn't that work?
Right.
They need to be able to work on their own, which is another reflection of being in research, because when you're doing research, you are often just working on your own stuff. So being autonomous, being able to do their thing, not that we're not there to help train and support, but people need to be able to feel comfortable where they're going to be leading stuff on their own. And they have to feel comfortable doing that. So you need to have a few years experience. If you've worked in agency, that always helps, because then you kind of know the pace. And that's one of the things I love about agency is that every day is different and it's super fast. I think when I left my PhD or left my postdoc and came in, the speed in which things went, I totally was like, oh my gosh, this is what I've been missing. When I was doing research, it can take a long time to do anything. And then that's just the name of the game. So I think we need to have people who are good at multitasking, people that are organized, good communicators. It's a lot, right? But depending on the level you come in, you could train a lot of that stuff you can learn on the job. But I think a good solid foundation in research, having done at least a degree in a postgraduate degree, having a good problem solver, good independent worker, and good collaborator. Those are the things I look for. And you can tell like a collaborator, like when you're even interviewing, their personalities comes through and they ask interesting questions and that kind of stuff. So yeah, I've been very lucky so far. I have a fantastic team of people with me, so it's good.
Amazing. Yeah. Maybe now we can move on to talking about STEM and like STEM as an industry. Do you feel like there are more women in STEM now? I would love to talk also about kind of the discrepancy in the number of women you maybe see coming into STEM versus like leaders in STEM or higher level hires in STEM.
So I've been out of the research industry for a few years now. I can tell you that when I was doing my PhD and my postdoc, there were women obviously doing the same thing, but I think there were and it depends. Like when we say STEM, that's like biology and chemistry and physics, and depending on I was in biology, so there were more women in biology. I don't know why at the time, but you even see with Nobel Prizes, it's usually men that are winning them, and when a woman wins, it's like, oh, a woman has won it. So right, so it's getting better. But so I would say that in research, it's getting. I think there's more women in research, which is good. I think when you go into industry, because there is a lack of understanding of what jobs are available, like you kind of like fumble your way through to find what's there, and there's jobs that are posted, and I can say that at Tank, I've never felt any kind of like, woman versus man, any kind of chauvinism, that kind of thing. So I've been really fortunate, and I've been able to move through and never felt like I was held back. I can imagine that for some women, it can be very hard, and they get to a certain level in their career and they're not given that opportunity to go further. And I have seen that with some colleagues that I know. So I think things are getting better. I don't think they're 50-50 by any means. But there's still a lot of work to be done. I think, like I have 2 daughters, and they one totally like science, the other one not so much, and that's fine, right? They can do whatever they want. But the fact that they just talk about it and as if it's a total option for them makes me feel like things have come a long way. And so I think that we are making strides in the right direction, but more needs to be done. And by having people in a position like myself and others where they are they're applauded for what they're doing, right? People are happy with the work I do, and I get to meet all these different people. They see women in these positions and they go, okay, well, it's not a big deal, and let's get more women in these positions. So I think it's like proof is in the pudding, right?
Exactly. And I think almost like there's power in breaking that, like, I mean, it comes with hiring more women, making sure women are given, leadership opportunities. There's power in kind of breaking down that, like, oh, there is this surprise woman in like a leadership position, or
Yeah. I do want to say though, like, when it comes to, like, I don't just hire women.
Exactly.
I hire the best person for the job.
Exactly.
And I think that's value, because I never would have wanted to get a job because I was a woman. I wanted the job because I was the best person for the job.
Absolutely.
And I think I've been fortunate that I've had, a good team under me, and, they are women, but it just so happened that way. But I mean, really impressive women who have a lot of experience, and perhaps maybe they had to have more experience in order to get people to listen to them. Then I don't know. Those are kind of areas where it's like, I'm not sure, but I think it's a good testament to our industry that more and more women are entering it. I think in agency itself, there's a lot of there are differences in the different departments, right? Accounts is much more women-led. Creative seems to be a little more man-led when you look at different percentages. I think for MedStrat, we're building our team the way we're building it, but it's at least the opportunities are there to have that happen. So I think that's really important.
And that's a nice segue into, like, talking about advertising. We talked about STEM, talking about the advertising industry and some of that discrepancy. Do you feel like it's similar to STEM?
Well, it's funny. I think it depends on the company you work in. I have not felt that at Tank. I really haven't. Like a difference between me and a man for the same job or whatever. I can say I have felt that in my past. There's other things where, just sit in the corner and do your job. And, so I think when it comes to agency, it maybe not woman versus men as much as the role you have. But listen, the more women we can get in, to different roles, not just accounts, but other roles in the agency, the better it is for everybody, because then you have different voices too. You're not just hearing from one. Like, we do a lot of creative, for instance, with we're doing like for women's health and that kind of stuff. And please have a woman in that discussion, right? Because it's like, and we have had a couple of things where we've had creatives come to us, men, and they're lovely and wonderful, and say, oh, we read this story about blah, blah, blah. And I'm like, yeah, we've been living this for 25 years.
Exactly.
This isn't new, right? So I think having those voices is, and they're all super like, you're right, sorry, open to that. But having that voice in the agency is very, very important for sure, because we represent the world. We don't just represent half of the world.
No, exactly. So you mentioned earlier a bit about evidence-backed data. Where do you feel, medical strategy and like having that STEM background lending itself in kind of rooting things in evidence-backed data?
So one of the things I love about my job is that I get to dig in to different, like I get made fun of. I love data, and I love like figuring out seeing you have a disease state, figuring out what's going on in that disease, figuring out what this new drug is to treat that disease, get all that information, get that understanding. So that getting that understanding is really important, but we also feel that is really important to explain to all the people that work on the team, right? So whether it's account people or creative people or writers or whatever, they all need to understand that. And to me, that's one of our roles, is to be able to communicate that information in a way to these people so that they are all bought in, because then we're all one team working towards a goal. We want all of the people on the team to be able to speak about whatever the drug does or the condition is in a way that the client will be like, wow, these people really know their stuff. So that's one of the things in medical strategy that we take very seriously. Whenever we get a new drug, we have a 101 that we teach everybody about what the drug does and that kind of stuff. But when it comes to the actual data, like how well does the drug work and that kind of thing, it's really important to understand all the nuances. And that's where you get into the nitty-gritty. And that's what excites me and my team, because we get to really understand how the drug works, why it works. And then when you have that information, you're able to build campaigns or concepts that really highlight it in a way where a doctor or an end user or like a patient or a caregiver is going to go, oh, that's really cool. Right. Oh, I get it. You know, I have to say one of the things I love about my job is when I'm explaining something to someone and I actually, bing, I see the light go off and I'm like, oh my gosh, they're getting it, you know? So I think it's really, it's very rewarding for me when that happens. But when it comes to the whole evidence-backed, we don't put anything out there that we cannot back up. In fact, it makes me uncomfortable. If someone says something and I can't back it up right away, I'll say, do not say that again. I will find a source to back it up. And if we can't back it up, then we can't say it. So it's really getting real data out there that people are going to, it's going to resonate with the audiences, and that is true and factual. And if we're not doing that, then we're not doing our job. So that's kind of where we start everything. It's like, what is the data and what can we do with this data? And then we got to make sure that we're doing everything in a way that it can't be boring. And it's not just going to be reporting data, it's how we report it. And that's kind of where the strategy comes in and stuff as well. So that evidence-backed data, you can't do anything without that, as far as I'm concerned. But of course, I'm biased.
Right. Well, that idea of rooting everything in truth is so poignant right now. And I think we look at, you know, I'm in social, we look at changes happening, you know, across social channels, and that idea of having truth or, you know, evidence-backed data, like however you define it, is just incredibly important.
I also think, like, when you mention social, it's funny, like, obviously 10 years ago, that wasn't even a part of the discussion. And now, like, and of course, in pharma, things are always behind where other industries are, right? So that now it's coming into the pharma space more and more. And that's where I can continue my learning too. So like I learn about whenever we get a new drug or disease to work on, I learn that. But learning how these things can work in the social spaces and that kind of thing and the channels, it's really been, it's been great for me. And I love to see stuff being used where in the channels that are going to have the most impact. And even 5 years ago, nobody was talking about it. And now we are, right? So for me, it's been really interesting. And to be able to incorporate that into our thinking has really helped develop campaigns that are a lot more relevant. You know, even doctors have their own social channels that they like to go
they're
in.
Influencers now.
I know. So it's great, right? So it's like, ooh, we can use that and we can figure out how to incorporate that in what we propose. So being on the cusp of that is really important. So it's not just, they know the data. It's they know the data. They know how to build the data in a way that's going to be compelling, and so that the creative team can understand it, run with it, make these campaigns that are phenomenal, and then make sure that we're delivering it to our targets in a way that they're going to be like, wow, this is amazing. So that's kind of like how we all work together. And I think with the social side of things, it's really enhanced. It's been a challenge because there's a lot of regulatory things in there that we have to be careful of, which is good because you learn how to work within the guidelines. But it's a challenge, but it's also rewarding, and it's also instantaneous, right? You get that work out there and you see things right away.
Absolutely.
And it's a lot faster than sometimes you do a journal ad, you stick it in the journal, you wait for someone to look at it, you're like, is this compelling? Is anyone believing this? You know, but this, like social media, it's right away. So I think it's been really good for the industry, and I think for medical strategy, it's been another opportunity for us to figure out how do we put this and use this as part of our thinking.
And I love that, the combination of two divisions, departments,
for sure,
emphasis, however you want to define it, you know, coming together to make something really powerful.
I think too, it's at Tank, we've been really fortunate because we have a big creative team. We have social media. We have customer engagement group. We have a lot of really strong people. We have great account people and brand strategy, and we all come together and we work really well together. And it's been exciting, especially over the last few years where we've grown so much, that to have all these resources. I can tell you, like 5-6 years ago at Tank, it was like me doing this and this and this and this, and now to have like experts doing that, it's like it's just elevated everything we do. So I think, you know, you were asking earlier about how medical strategy is going to evolve. I think, you know, the social media part of it is something. It's like, how can we do a lot more purpose-driven creative, but in a way that has a medical twist to it because that's the area we're working in. And so I think all of us collaborating together, we're much stronger for sure.
Yeah, absolutely. Yeah. It's a lot of fun. I would love to talk a little bit about you as a leader. You as a, like I mentioned earlier, you're a pioneer in this medical strat division. What do you think are things just, about yourself that have led you to this place? I mean, you and I have talked about, being change makers or, having just that curiosity of new things. I would love to just hear your
curiosity
thoughts on
is the perfect word because I have a curiosity and I love to learn, and I've been doing this a long time and I still love to learn. So it's been a really good, for me, like I said, the industry is so fast all the time that I'm always learning something new. I always tell my kids, you learn something new, it's a good day, right? So as a leader, it's been, I'm always a work in progress. I haven't solved it all. I said, I started off as a researcher where I was by myself doing my own thing and then transitioned into a medical writer, not leading anybody, but, having a voice, having a little bit more of a voice. Then running a medical writing department, building it, working with the writers, it allowed me to kind of learn a little bit of the management side of things. Learning how to deal with different personalities, learning how to help people when they're feeling down, like you're not just like worried about the work, you're worried about mental health, you're worried about all these different things. And then medical strategy has been, I'm really fortunate because I have a very strong team where I am able to really, they're all carrying their business and I'm just kind of helping where I can, but always looking out for them as to what's the next opportunity for them, what can I do to set them up for success. So I do think about that all the time, and I always want to make sure opportunities are, there's a lot of opportunities in the world, but sometimes you don't know about them. And so I want to make sure that my team and other people at Tank get those opportunities and are recognized for what they do and what they bring. So I think elevating my team only makes me look good, frankly. No, I mean, really, and it's not about me, it's about what the team can do and what the team could do for Tank worldwide. And I truly believe that it's not I'm a leader. And I think really a lot of what is behind a leader is what you do day to day. You don't say, I'm a leader, no, I'm up here. It's like, I do my job, I do it this way, and people come to me and they ask me for help, and that's how I think I'm a leader, because I'm able to do that in a way that's, I'm all about just getting the job done, frankly. And anybody seeing this will laugh at that because it's true. But and I'm very pragmatic, so I can see how it's important to talk and make sure that people are listening to you, but it's important to get the work done as well. So in my role as a leader, yes, I lead a team of people, but I also try to make sure that I'm helping and I'm working together with people so that we're moving everything forward in a way where people feel respected, and that's the most important thing for me.
So you mentioned earlier this feeling of like kind of almost fumbling through the STEM industry, the biology industry, wondering where you fit best. What are maybe what's some advice? What are some recommendations you have for people who might be in the STEM industry, in advertising, in any industry as a whole, feeling that kind of lack of direction or not sure what they're going to do next?
So I think one of the most important things is to be open-minded. We were talking earlier about saying yes to things. So there might be, some people often will go into research and they think, I have to do this, I have to do this, I have to do this. And they're not happy doing it, but they feel like they signed up for it and they have to do it. I don't think that's true. I think you can do something and realize, you know what, this isn't for me. And when you do that, it opens other doors, right? So I think saying yes and being open-minded and not feeling like you're stuck in something. I did finish my degrees, but some people didn't. They just were like, this is too much, I can't take this. They left and they went on to another career. Some people left science completely. So for me, I was fortunate because I liked what I was doing and I liked the science, right? I got tired of doing the research part. So then I was looking around going, I looked at LinkedIn, I talked to people in the field, and I was like, well, what is this? What is that? And I saw this advertisement for medical writing and I literally fell into it. I was like, what? I never heard of it. And so it's really one of these things where you have to be open, right? Don't just say, oh, I can't do it. There was a couple of things, I won't go into details, but I went into the interview for this medical writing job. I didn't know what the regulatory body was. I knew nothing. And I went in, and I thought I didn't think I knew it all, but I thought, oh, I'll be fine. And they were asking me questions, and I was like, oh yeah, I can learn that. And I did. I learned it all. It was like super was very stressful. I learned all the regulatory stuff, and then I became better at my job. So you have to work hard. That's definitely important. So whatever you choose, work hard at it. I always say too, if you're changing jobs, and goes for everything, what I've learned in my life is give yourself 6 months. So when you start that job, the first couple of months are going to be hard. It's going to be different people, different things you're doing, stuff you're not comfortable with. If you give yourself 6 months, after about 6 months, you'll feel better. And if you don't feel better, get out. Because honestly, you need that time in order to feel comfortable with things. But after 6 months, if you're still not feeling comfortable, I find that that's a time where you can, yeah, this isn't for me. Or speak to your supervisor and go, you know what? I was thinking of this. You can always be thinking about other things you can be doing, right? And so, yeah, what did I say? So work hard, be open-minded, don't give up right away. And I don't know, I think being a really collaborative and open to hearing other people's opinions is super important. I really have to have that, you don't go into a room, I used to say this to my writers, don't go in a room like you know everything. You go in, you check your ego at the door, and you sit there and you listen to the team you're with. And you add your 2 cents because you're there as the expert, but you don't know more than everybody because everybody's coming in with their own perspective, right? And everybody deserves to be heard. So if you're doing that, then it's a much more collaborative thing. And you get better work. Well, the minute you have an angry person the work is not as good. If everyone's collaborating and they feel like being heard, that's important, right? So all these things are good to be able to build a career or a job or be happy somewhere. Those are the kind of things you need to kind of look at, like that respect and collaboration. But yeah, those are the advice I have, like be open-minded, give yourself a bit of time to find and try anything,
I love that point that you said about, kind of giving yourself the grace of 6 months. I feel like that's advice that I definitely could have used when I was first starting out, because I feel like you enter any industry and you're just kind of like, what is going on? Everyone knows more than me. I don't know anything.
And it doesn't get better as you get older. Just to let you know, every time you go somewhere new, you feel the same way. Yeah.
But no, I just wanted to say, I think that's, amazing advice.
Great.
Well, Jen, thank you so much. This has been so lovely to hear about you and your experience, talk a little bit about the STEM industry and the advertising industry. Just want to say a big thank you to New York Festivals and their Healthcare Awards for giving us the opportunity to sit here and chat.
Well, thank you.
It was a great conversation.
Yeah, it was fun.
So amazing.